Welcome everyone to a special episode of Heart Talks with Dr. Gloria. I am the guest host for today. My name is Tracee Holloway. Today I will be interviewing Dr. Thomas Anderson, our normal host of the show, and also Dr. Ugo from New York. And I want to just take some time to introduce them both. Of course, Dr. Gloria Thomas Anderson is the host of the show. She's also the president of Heart Tones Inspirational Company. She's an author, she's a licensed social worker, licensed minister, and an assistant university professor at North Carolina State. She's the author of the African American Spiritual and Ethical Guide to End-of-Life Care. What y'all gonna do with me? Let's talk about it. And today we're gonna talk a little bit about her book, as well as talk with Dr. Ugo, who is a medical doctor in the state of New York, where we've seen a high number of cases and deaths, unfortunately, from COVID-19. So we're gonna talk about the FAQs of COVID-19 and also some of the most important points that people need to know about advanced care planning.
Thank you, Tracee.
It's a pleasure to be here.
So I want to start by just saying a few things that from what I've noticed about what's happening now with COVID-19. I'm a mother. I'm also a business owner. I'm also, dealing with some of the trends and the news in the work that I do. And so I'm staying abreast of some of the facts and some of the myths as well. So one thing that I know that I've seen a lot of is whether or not people should even believe that COVID-19 is a real issue. There are actually myths out there about it stemming from 5G and different other things, and not that it's a medical issue. So I want to talk and ask that question first to Dr. Ugo and say, Dr. Ugo, yes or no, how serious is this? Is it a real deal?
The answer is unfortunately yes. There's been a lot of debate as to where it started. Did it come from a bat? Whatever the source was, whichever the way it came, whether it's from Europe or from China here directly, it's definitely real. Living in New York City and having lived through the global pandemic here in March and April of this year, we didn't really have to news to feel it. People we know are taking care of patients with the disease, people we knew have the disease, people we knew were hospitalized, and even unfortunately people who we know personally perished from the disease. So it's definitely real and definitely something that everyone should take seriously.
Right. And then taking it seriously too, part of that and the impact of that, of course, is that it's been hitting families and individuals so quickly that a lot of times they haven't had time to plan. There were even a lot of news stories about hospitalizations and emergency room visits that were happening, people going to the hospital and then their family members not being able to come into the hospital with them. And so essentially that being their last time either seeing them or live or seeing them until they were able to be released. And so that brings in the question and ties it in with advanced care planning and the importance of doing that. And Dr. Gloria, that's what your book is all about. It's all about taking the first steps and actually talking about your healthcare wishes and making decisions and all of that. So can you tell us a little bit about your book and, why you feel like it's so important at this point in time?
Sure, Tracee. Yes, I believe that right now, especially with COVID, unfortunately, so many people, and we know too, most of us are aware that the disproportionality of infection of the disease is toward African Americans. So the numbers are 2 to 3 times higher rate of infection and deaths from COVID in the Black community, Black and Brown communities. Part of the reason why advanced care planning is so important, even before COVID, but especially now, is because this is something that it's an invisible disease. We can't tell if someone is infected by it, asymptomatic. People are walking around not even knowing that they're carriers. And so families are being impacted by this. At all times, we realize death is a part of living, but with this, I believe that it's really important to have conversations with your loved ones about what your wishes would be if you're not able to speak for yourself. If you do contract this, and hopefully and prayerfully you won't, but should you do that, what would you want done? Would you want to be on a ventilator? Would you want, what services would you want done? And so letting your family know that is important, and or your loved ones know that. And by completing an advance directive and having those conversations first, and then completing something to just spell out what your wishes would be as a document that you can let your medical people know and your family know. It's just comforting to know that your wishes would be honored in that process.
Right, right. And that takes away the guesswork too on the medical staff side of it, because from what I've been reading and studying, sometimes the numbers skew toward one type of treatment over the other. So Dr. Ugo, if you could just kind of explain to us what medical treatments are in place for someone who is suffering specifically with COVID-19, but then also just in general, some of the end of life options that might be, or the life-saving options that might be presented to someone in a life-threatening health situation.
Yeah, so I think that one of the most interesting things about this novel coronavirus is that it presents in so many different ways. There's some people who have it and they're asymptomatic, that means they won't have a single symptom. They can get it and have the full course of infection lasting for weeks and recover and never really know from any physical symptom that they had it. However, most typically, it became known when it was first seen in Wuhan, China, and then eventually when it came over here to New York City and to California and Washington States in the beginning as a respiratory disease. And so what that means is that it would present with a lot of shortness of breath, coughing, along with that, fevers, and that just wouldn't get better. For people who were asthmatic, the typical treatments weren't working. Antibiotics being given to people weren't working. And what people were finding was that it went from them having flu-like symptoms to it just progressing to the point where their oxygen levels began to drop, and some people were passing out and having to go to the hospital. And in the hospital, really the whole treatment was to see whether or not you're able to turn around the process, get people breathing again on their own, or if they needed to be put on a breathing machine, a ventilator. And for people whose just oxygen levels would not improve on their own despite antibiotic treatment, positional treatment, and other treatments, they would need to be put on a mechanical ventilator to actually breathe for them. And so once you get to the point where you have a mechanical ventilator breathing for you, that's typically done in the ICU setting. What they do from day one is to see how quickly they can get you off the mechanical ventilator. And for some people, they're able to get off in a couple of days. And for other unfortunate people, unfortunately, they never make it off. And so really the big question when it comes to advanced care planning is, even before coronavirus, is do I want to have a machine breathe for me in the situation where I cannot breathe on my own? Do I want to be resuscitated, have my heart restarted in a situation where my heart stops on its own? And the answer to that question is very specific, very personal, and something that really needs to be discussed with the patient, the family, and the primary care provider long before hospitalization.
Right. And the personal impact of that, the personal side of that discussion is something that is not always done in a way that historically that African Americans feel comfortable with. Like from our research, and Dr. Gloria, a lot of this I've gotten from your book and just working with you over the years in your work, is that there is an historical distrust or mistrust in the hospital system or the medical system as far as African American treatment in that. So Dr. Gloria, if you will, just tell us a little bit based on your research and your book and the work that you've done in that, what are the historical implications of the mistrust in the healthcare system from an African American perspective?
Well, thank you, Tracee. Basically, it evolves from the whole historical time from slavery to even the current times, where medical experiments and research was done on Black people for experiment purposes, many times without their approval. And because Black people, I'm not to give a history lesson on slavery, but Black people were considered property, not human. And so that gave a justification, if you will, in the medical field for people to look at us as a way to explore whatever diseases they wanted. The one that's most noted by most people is the Tuskegee Institute research project with the Public Health Department doing the syphilis test. And even though they had found the cure, if you will, they found a cure for it, they still withheld that cure, that treatment from those Black men and told them they had bad blood. Bad blood was not the case. It was that they had syphilis and it killed them. And so they wanted to see the progression of that disease. That wasn't unethical, but that is just one of many. That's the one that most people know about. I remember one of our relatives who hadn't gone to the doctor for many years. And part of her rationale was because she understood and knew about that particular experiment. She wouldn't go. And when she did go, when she was forced to go, she had to be restrained. It was just that much trauma associated with this kind of knowledge. So the mistrust is because of the experimental things that have been done to Black people. There's a book that came out in, I think, 2007, Washington. Her name is Harriet Washington, I believe, and it's Medical Apartheid. And she gives a historical of the whole history of the mistrust and why that still is an issue today.
So, you know, with that being said, because of the experiments, because of that sort of mistreatment of Black people in the medical community, now when doctors are telling us you need to go in as soon as you have symptoms, you need to wear your mask, you need to stop smoking, you need to stop hanging out and things like this. This applies to everyone all around the world. But because of those things there, it you know, often is misunderstood by African American and, you know, as far as a culture.
I want to say something on that note, if you don't mind, too, about the culture. It's also proven and it's documented that many times Black people do go in for different treatment for, you know, whatever ailments are going on, and they are not taken as serious. Sometimes they are not even given the services or the treatments that they really need because of race. I can use myself as an example. When I wrote the booklet in 2006, I was misdiagnosed by a doctor who made an assumption that because I was Black, that my high blood pressure was hereditary. Or she misdirected me based on that assumption, not doing any other tests. And I actually had a life-threatening illness that almost took my life a year later, because she did not order tests. She did not look past what she thought her prejudices or her biases, or even what she assumed was applicable to Black people. That happens all the time. There are many times Black people are denied services that non-Black people get, and that's also documented in literature and in the research. So mistrust is a reason. There's a reason for the mistrust.
Right.
A classic example is patients with sickle cell disease, sickle cell being a blood disease that predominantly affects Black people. It's very silent, you know, you wouldn't know a person has it, but one of the ways it manifests is in very severe pain. When people are having a sickle cell crisis, they can be in very severe pain and they require medications, but oftentimes when they come in and they're perceived as being a young Black man or woman who's asking for pain medications, the assumption can be that they're just drug seeking. And so that's a classic example that's known, you know, throughout medical literature and just experience of a situation where predominantly Black people, when they're coming for help, aren't getting the help they need. And instead, there's a stigma being attached to them as just being drug seeking and being there for, like, you know, nefarious purposes.
Yes.
Right. And that's very unfortunate, actually, because, as we've seen in the numbers with the COVID-19 and the coronavirus, this virus is impacting African Americans more than other cultures. By when we say more, it just means the highest numbers, but it doesn't mean that there aren't any high numbers for the other ethnicities as well, because their numbers are pretty high as well. But it is impacting us a lot more because of those historical and generational systemic differences in healthcare and provision and how that's gone forth. And a lot of it relates to the other thing. I do have a question here then, because that brings me to want to know, how can we begin to bridge the gaps between how African Americans are treated in healthcare and how African Americans seek healthcare, and just bridge that gap to get more understanding for those conversations about ACP that need to happen, the conversations about life saving measures that need to happen, the conversations about end of life care planning that need to happen in the medical environment. How do we bridge that gap of culture, lack of knowledge, and understanding?
Yeah, I could start by saying, I think this is where representation matters. I know, I had the experience, I remember as a med student, when I had a Black couple as a patient, and they were beaming, smile from ear to ear. And I didn't understand why. And, they seemed very proud of me. And I really didn't get it at that point of my life. Years later, I completely get what that was about. Essentially, they had lived to see situations where there was no Black physician to go to. And then all of a sudden, there was someone who looked like them, talked like them, who they knew, who they could expect to maybe look like their parents in the doctor's eyes in a way that maybe they'd never had before. And so it meant something. It meant that they felt like they were seen and heard, and their concerns were seen and heard. And so I think representation matters. We need Black physicians, we need Black nurses, we need Black anesthesiologists, et cetera, and I think that would help. And then I think it goes beyond that. We need Black counselors, we need Black advocates. I think every single patient needs to have an advocate with them,
Yes.
Someone from their family or friend who's there in the hospital system helping them navigate, and who can just help them interpret what's going on at a time where they're at their most frail mentally, because they're dealing with a life-threatening illness. And so, I think when it comes to being able to ultimately hear it from a voice and from a vernacular and from a cultural experience that's similar to their, they know they can trust it, and they tend not to automatically have to put up a guard that for just preservative purposes they've had to have all their lives. I think just being able to let that guard down and to hear the medical information and not to have to look for the racial undertones that we're used to dealing with in society helps a lot.
And I agree with you there. The representation, it does matter. Just generally in speaking about that in medical environment, and then also just on television and all sorts of other ways, representation matters. It matters when you see people doing what you have in your mind to do, that are doing it and they look like you. It helps. But Dr. Gloria, we know in the work that you do in cultural diversity and cultural competence and all of that, that you're helping to bridge the gap between the non-Black culture and the Black culture. And how does that work in your world, where you're actively working with persons who are looking to do that?
Wow. Yeah. Well, right now it's a good time for that, because we all really need to be working toward equality and equity for everybody, and we're seeing the fallout from that through COVID. It's exposed. It's really brought from under the cover the whole institution of racism in our society, in every area, from housing, from employment, from healthcare, and healthcare is where I work in that particular component as a social worker. And I would say, in terms of bridging the gap, it's been 400 years of building. So I don't see it being immediate. I'm not being non-optimistic, if you will, but I'm saying that we are social beings, and we are indoctrinated by what we learn from around us, what our environment is, what we see, what we are around what we hear. And so we grow up with certain kinds of prejudices, certain kinds of things that are truths to us that may not be true. And with that, dispelling that, we have to do some soul searching. I believe that it really starts on an individual level, that we can't look to governments to do it, because governments really are a reflection of people. Systems, laws, legislature, all of those things are part of an institutional making, a construct that goes deeper. It's very, very deep. And so when I work with people to help them come to recognize or just to acknowledge some of those things, that like what I shared with my doctor, who was a white female who had preconceived notions about what Blackness was, what that meant in terms of disease. She didn't get that from osmosis. She got that from her training, her exposure, from her environment, and all of that. So I believe that it's very important to go within yourself and do a real self-check and say, what are my beliefs? What am I valuing? How do I see people that are different from me? And then look at that, because that will reveal to you the work that needs to be done. Diversity classes, trainings, all of those are wonderful, but they've been proven they don't change people. People have to change themselves and have the desire to make that change. That's an internal working. That's not something that can be done through a classroom or anything like that. So that's what I try and get across in terms of working in white circles, in non-Black circles, and working with Black communities like me to help. When it comes to the advanced care planning part of that, that's something that I think is our own responsibility as a people. We have to be responsible for our own health care. No, I believe in God, and many people do that are Black. I think Pew Research said about 85% of African Americans believe that there is a God, and 75% have some type of faith belief. That's huge in our community. We make up only 13% of the US population. So that would say the majority of Black people have a faith or spiritual belief system. That's another area that is often overlooked in medicine, because medicine sometimes divides that out and not look at the person holistically. So when a person says they believe God to bring healing, some medical people who don't understand the cultural dynamics of that don't understand it and won't respect that. And in terms of helping to bridge, you have to be respectful of the differences, whether you understand them or not. It's just honoring people for who they are as part of humanity. So,
Right.
So when it comes to advanced care planning, the part that matters, that I see that's really important from my own life, from the experiences I've had working with families for many years, is that there needs to be an advocate, as Dr. Ugo said, for every member of the family. Somebody that is able to navigate those systems. They can be very complex. They need to be changed, but again, that's institutional, and it's going to take time to unravel. But having someone who can speak for you, if you can't speak for yourself, having someone to help you make decisions, all of those things are important, because if you cannot speak for yourself, you're really at the mercy of systems. And that's not a way to be honored in your life, whether you're in life or in death.
Right. And we've seen so many times in news stories in various situations, either personally or, a few degrees separation from us, where those things weren't known, weren't talked about, weren't respected. And so there is a very strong urge and push now for people to make their own decisions and to do that. In fact, Dr. Gloria, I know that you recently had a press release out about the urgent need for healthcare planning or advanced healthcare planning for those who are pushing the social justice movement forward and protesting, because they're gathering in numbers that are huge. And a lot of times there's no mask, there's not, hand washing. And so there's a risk of COVID-19 spreading around and those huge environments. So I'm going to come back to you on that point, but I want to ask Dr. Ugo, as far as being in groups, large groups, small groups, what is the best practice for groups right now?
Yeah, so part of it is it depends, and it depends on where you are. In New York City right now, we went through the worst of our numbers in March and April of 2020. And so as a city, we're actually just on the cusp of entering phase 4 of reopening businesses. And this means that outdoor entertainment can be opened up and items like that. And so for us here in New York City, we've gone from where it is for maybe a lot of people right now throughout the country, where your group should be 10 or less, 10 to 15, depending on which municipality. That's a number that's been used. And we're up to the point where they're considering even groups as large as 25 and 50. We're considering opening places of worship and places like that. And so it really does depend. And so I really would advise every person to make it a practice to regularly check their city or their state's health departments to know what the ongoing recommendations are right there and then.
Mm-hmm. And then Dr. Gloria, your message was to protesters in particular who are, as we've seen, for the last several weeks now, gathering in large numbers. What do you see as the risk there, and what do you want to share with them to do before they go out and do their rightful right to protest peacefully?
Right, and I believe that right is very important, and that whoever can do that, kudos to them for being brave and courageous enough to go forth to do that. It just protect yourself, do the proper protocols that are required, the mask wearing particularly, and those around you, my prayer is that people will honor each other by, even if you don't want to wear the mask. I've heard comments here locally where I'm in North Carolina, people leaving their mask in their car or saying, I don't feel like putting that on, or I can't breathe in it, or whatever else. But the disrespect for others when you don't do that, because it has been proven that you are protecting other people when you wear the mask more than you're protecting yourself. So I would just encourage people to protect each other, to care enough about the person next to you to do that, at least have that safeguard in place. We know too that COVID is impacting African Americans at a higher rate, disproportionately, also because of comorbidities or the chronic illnesses that are already pre-existing. And so those people, I would recommend to take every precaution not to expose yourself when you're at a higher risk, and high blood pressure or, diabetes and other, and even stress levels. I mean, your stress, the stress, there's a lot going on in all of us right now, basically, whether you're healthy or not, in terms of this is a very uncertain time. We don't know what this looks like. We're hearing reports that it's another strand coming out that's even worse than what we've already seen. There's a lot of devastation. There's a lot of people going through grief and that have lost loved ones, lost their jobs. So it's a time that's really a heavy burden on many people's hearts right now with what's going on. And so I believe that in terms of preparing for life after now, and that we just need to have conversations with our loved ones about what our wishes would be, that they could be honored whenever that time comes.
And if I can say very quickly, I think it's important to know that a lot of people who are spreading the virus don't know they're spreading the virus, of course. And so when you're leaving your mask in the car, you very well might be one of those 1 in 5 people who have it, but who are asymptomatic. In fact, in some studies say it's up to 2 in 5. And they say, again, that even for people who will have symptoms, the day before they have symptoms is one of the peak periods where they're very infectious, probably because the disease has moved along, but they're not yet curtailing their activities because they don't feel anything. And so they're hugging grandma, they're meeting everyone in their family, they're visiting neighbors, and they don't realize that in 24 hours, they'll start to have that cough or that fever. And in that period of time, they could be spreading the virus. And so they say, just to compare it to the flu, there was some comparison to the flu. The flu, if 10 people got the flu, they would pass it on to 13 people. For coronavirus, if 10 people catch it, they pass it on to 20 people. And that's one of the big things about coronavirus, in addition to it looking very different, is that it can spread much quicker to larger populations than the flu does.
And that's been happening too. I know a couple of families that have had events where they were gathering and everybody was healthy, or they thought, and there were people that were asymptomatic in their presence. And after a week or two, then there were people actually who have died in that family group because of attending a celebration. So it's a lot to think about, but can we wait to love our loved ones? Can we love enough to stay our distance and not to jump too quickly to gather, because it could be deadly by gathering for something very important, even funerals. I've read those stories and statistics as well, where families have come together and that's something in the Black community that's really, this is homegoing services are our way of releasing our loved ones, and we get support, we hug, we feed each other, we love on each other. That gives us that strength through this. Right now, COVID has taken away that ritual, that real important ritual of saying goodbye to someone who's passed on. So this, like I said before, there's many components to this whole pandemic that are impacting people in very severe ways. And, so I would encourage you, if you are really struggling with that, to reach out to someone that you can talk to about where you really are, because really that's the other thing. The suicide rates are going up. There's a lot of things to be concerned about. And as a social worker, I just recommend, don't hold thoughts to yourself. Don't think that you have to be so strong that you can weather through it. Talk it out with somebody that you trust. And if you need more help than that, take those next steps to find the professional help that you need, because life is precious, and we all need help at times.
Yeah, that's absolutely true. And I'm glad that you said that, because, self-care, therapy for one, and counseling are a big component of receiving medical treatment. For people who fall into anxiety issues or depression from being quarantined, there are counselors now who have jumped on the virtual train, if you will, like everyone else who's tried to pivot to do something different, to still kind of keep doing what they're doing for business or for helping other people. But we have to jump into an online environment. Therapy for the longest time has been seen as taboo, as something that is kind of like, you don't want to do it, but it's so necessary, because having good mental health, when we're not able to be together, when we're not able to gather normally, when you're not able to work normally or exercise normally or even eat out normally, all those things are changing. Good, strong mental health is good to have, and seeking help when you need it is imperative, Dr. Gloria. So I definitely agree with you on that. You also mentioned something too about the government aspect of the government chiming in on what needs to happen for this and that. And we know that we've seen and heard where the government is different parts of it, but I'll just talk specifically about the mask wearing. There was a lot of pushback about people exerting their right to not wear a mask, sometimes citing the ADA as an exception for them. And of course, our health, our situations are personal to us. They're private, they're confidential. We don't have to share that. But the government did step in and say that businesses can now mandate the wearing of masks. And so we're still seeing that same pushback of people not wanting to wear the mask. And Dr. Gloria, like you were saying, we're all going through this together. We are all in this together, and mask wearing is very important. So Dr. Ugo, I know as a medical doctor, you're going into the hospital system, you work in the clinic environment, the office environment. What are you seeing as what do you say is a necessary type of mask that people should be wearing if they're out with other people? What do you guys as doctors and professionals in the healthcare environment wear? And then, is something like this, like what we have, the cloth masks, these are ones that one of my clients made and my daughter made. Are these sufficient for, just the average Joe of us?
Yeah, so I'd like to start by saying, wearing masks didn't start in, March 2020. We've been wearing it as physicians. Surgeons wear masks for multiple hours at a time when taking care of their patients, because they don't want to spread their germs to the patient. It is uncomfortable. It's not the most, attractive thing to have on your face. But the concern for the patient is, for the surgeon is, I'd rather put myself at discomfort for my patient to make sure I'm not spreading my germs to the person. And even from patients, I know a lot of people haven't really been exposed to it, but in the medical field, we do have patients who've been wearing masks for decades too. Patients who have undergone chemotherapy, cancer patients, bone marrow transplant patients, they routinely sometimes have to wear masks in some situations around the hospital to protect themselves, to protect others. And it's never been political really up until 2020. So it's a little surprising that it's become a political issue, whereas it never was before. But in terms of the different masks, the best mask to wear is the one that you're going to keep on. And so the cloth mask, especially if it's 100% cotton, tends to be the best tolerated, especially during the summer. This one has loops that can be placed around your ears. Some people find that they hurt their ears, and so you can have ones instead that are almost like ties that you can kind of tie them in the back of your head instead. And then usually there's a firm portion that you fit around your nose, and then this portion that you tuck under your chin. And so really, if this is the only mask that you can wear that's comfortable, it's fine. It will prevent your germs, your spittle. We've all seen those people who, when they're talking, you can kind of see their talk leave from their mouth up in front of them. This helps to capture some of that, whether it's sneezing, whether it's coughing, whether it's just, the guy with the sprays and who has a lot of S's to say, this will help with a lot.
Yeah. Right.
You have the next step of masks, the surgical masks, that again, they tend to have the loop around the ears. And so you have to be used to dealing with that. Not everyone needs these, but again, if you can have access to them, and I think nowadays most people have been able to access them, unlike what we couldn't really in March. These are the surgical masks, again, fit around your ears, contour to your nose, and then tuck under your chin. And then then there's some masks that are more, less about preventing your spray to other people and more about protecting you. This is something called the KN95 mask. It's available in a lot of Asian countries and available through services like Amazon and online services. And you can order this for yourself. And essentially, this is more the grade of mask where it's actually protecting you from other people's germs. It's thicker, but the KN95, this is the way it's designed. People find it's easier to wear and tolerate a little bit more so than our typical N95 masks. And this is what your physicians, your nurses are wearing in the hospital. This one, it happens to have a duckbill format, but some of them are more just round around the face. And again, it's thicker. This one also has a elastic band that fits around your head. And essentially, this prevents other people's germs from coming to you. And then, it gets even more serious depending on how much you want to take this. There are these masks that people use for spray painting and preventing, like P100s, and people can use these technically to prevent germs from coming to them. But typically, when it comes at the end of the day, between the cloth mask and the surgical mask, this is what you usually need going around out and about on a jog with your family in the park, at the grocery store. These ones will typically be enough.
I'm seeing people go to the swimming pool, take walks. When I go my walk, I always have my mask on. But I'm seeing other people all around me, pretty much most everyone, not wearing them when they go on walks or when they go to the pool here or when they are just even to the grocery store. I know that the store, they are mandating, which is a good thing in my opinion, that you can't come in, but I'm seeing people walking around and not having them on until they get up to the door and then putting it on. What do you think about that? Do you?
Yeah, so I think first I want to point out that although a lot of places in Texas, there is a mandate, there are some cities and states where there isn't a mandate, like in particular Georgia, the governor has, put out a ban for even cities like Atlanta to introduce a mandate. So he's saying you cannot mandate it. So not all places, unfortunately, have state governments that are enforcing the ban. But for those places that are, I think the loophole we use here in New York City is that if someone's within 6 feet, that you should have it on. Now, if you're jogging, again, and you really find it very uncomfortable, it's okay to pull it down or to have it in your hand. But really, once you see from a distance someone far away approaching, you should put it on for their benefit. Or if there are people around you, you should put it on. But yeah, by the technicality, they're saying either keep your social distance 6 feet or greater, or have a mask. And really, for the best case scenario is just to do both, to have your mask on as long as you can tolerate it, and especially if someone's closer to you.
Yeah.
So Dr. Ugo, when you talk about, wearing the mask if you're at the grocery store, and if you're, coming on somebody that's walking on the same path, put your mask on, that kind of thing. We still are doing regular things, some of us, like going to the grocery store versus online ordering and having it delivered, which is, to me, the better option. But still, there are a lot of changes there. So, for example, grocery store shopping. How concerned should we be passing someone in the same aisle as us, or touching the cans and putting things in the bags and then putting in our car and then coming home? How concerned and how much caution should we be using to do even those regular things like that?
Yeah, so I wouldn't blame it on the grocery store in and of itself. I would just say that it just represents yet another scenario where you're indoors with people who either are or are not practicing appropriate public health measures at home. And this grocery store just happens to be one of those places where we all come together with our different practices. And so, yes, it does represent an opportunity for transmission because it's indoors and because quite a few people frequent there throughout the day. And so really, I think, in terms of best practices, you wear your mask. Really, if in the grocery store, whether or not someone's there, you should have your mask on. And like we said, a lot of places are mandating that. You should have hand sanitizer. Luckily, that's more available now. Every few, minutes, just put some of it on your hands and make sure your hands are clean. Wearing gloves helps you, but doesn't necessarily help other people. People, when they wear gloves, they tend to be a little bit more daring in their touching. And so they can be just spreading germs from one place to the other in a way that's not helpful for other people. And so really just kind of hand sanitizing, and then when you can, wash your hands is best practices. And then still, when you get home, we still wipe things down and wash our vegetables, and we do everything possible just to make sure that if there were any germs, whether it's coronavirus, the flu, or otherwise, that we're washing those and cleaning those off of our grocery supplies.
I'm going to tell y'all something. I have a really OCD routine, and that's because, I just am that concerned about just washing it off. So when this first started happening, I saw a video someone sent me about pretending as if the germs were glitter, and I was like, oh my gosh, glitter never comes off. So there's
that's not a good way to say it.
So I was like, if it's glitter, we're all in trouble. But no, just pretending as if it's something that you can see. And then trying to wash it all off in a very careful way as to not, move it to the next area. So I likened it to like a powdery substance, like a lemonade powder or something that you would put, and how that just, it poofs out into this cloud of smoke or whatever, a fume, and then it dissipates and it falls on your table, for example. You let a little drop of water get on your table, and then all of a sudden you see it's yellow, it's sticky, or it's red or whatever. You're like, why is it red? It's because that lemonade plume or settled down. So I think of it that way. So on my groceries, we're wiping everything down at the store, at the grocery store. I carry the bags in a little baggie. I wipe it down at the store. I wipe it down after I scan it through and put it in the bag. I wipe it down at the garage, which is our kind of entryway point. And then when it comes into the house, before we put it away, I'm wiping it down again. And so that might be a little overkill, but it's our routine. And so, just going grocery shopping and things like that, I think we've all taken on a different routine with
right.
it all, going in and out. So what's your routine, Dr. Gloria?
I was gonna say you're good, because I'll forget. I'm gonna be honest. Okay, so I get the bags in my car, and then I get home. I wear my gloves, Dr. Ugo. I have my gloves on. I have my mask on. So when I get home, I forget sometimes that I don't take my mask off with my gloves because my gloves are touched. So now I'm contaminated that. So now remember, I can't put that back on. So I sit this somewhere. And then I have to take all the stuff out of the car and take each thing out. And I'll leave it in the garage for a day. I used to leave it in there a couple of days, things that don't have to go immediately in the refrigerator. Get the Clorox wipe everything off. And then I'm like, oh gosh, I forgot to take off my shoes. They are supposed to stay out in the, so sometimes it just gets to be too much. So I wind up having to clean every place I've walked, go vacuum, just too much, and it's like just to go to the store, just to have a meal. It's just like
a little routine, I think, is better than no routine at all and just business as usual. I've been in the grocery store line with my wiped groceries in my arm, because if I can't carry it, I'm not, I don't get the little cart unless I need to. Yeah. But for the most part, I just get what I can carry. I wipe it down, and I've been in the line before. I'm choosing between going to the cashier who has on gloves and going to the self-checkout, which is just more work for me. So I go to the cashier line, and I'm looking, and I see that the cashier is just, doing the person in front of me's, groceries, scanning everything. And then when they're done, they give them the receipt, and they do nothing with their hands with these gloves. And I'm thinking those gloves just touched about 80 items,
right?
Cash.
Yeah.
And then she's just going to touch my groceries. No, ma'am. So I moved to self-checkout, and I just do it that way. Yeah. So there has to be a routine that we can establish that works, that we can remember, that will work. And then I think also, in those public environments, what should they be doing? In my opinion, they should at least be cleaning their gloves or taking them off, putting on a new pair in between everybody. But again, I go a little overboard.
It's interesting. There's a couple of layers of it. Number one is just there is a psychological layer of having a routine, where I think especially in the beginning where the problem seems so big, just having a number of things that we could do personally to protect yourself and your family matter. Knowing that, okay, well, I can't find the vaccine to the virus, but I can make sure that if I'm bringing groceries into my house, it's wiped out. And so I think that's important to schedule a routine. But then secondly, I think you do have to kind of have one thing and stick to it, because the more things you introduce, then the more you're kind of confused about what to do here or there. And so whether or not it's deciding, you're putting your things away, you're wiping it down, or leaving what things that can be left in a paper bag, near the door, and then bringing them in later on, hours or days later. But I think, I think really as long as you are doing some sort of washing of your foods and then wiping down, then you more than have done enough. The data shows that transmission through groceries, once they're kind of in your home, is relatively very low, which is great news for our family. In terms of the cashiers, they're in a different situation. They're more as functioning as essential workers. And so it's almost like, the New York City transit person who has to deal with everyone coming onto their bus, or the nurse who has to deal with a number of patients. They're going to have some items that really are just to protect them as people and to protect them and their families. And the gloves are part of that. So the gloves aren't helping you. Those gloves is just as well as if they didn't have gloves to you. But it does help them, because after a couple of customers, hopefully they're taking them off and putting on some fresh ones. But those gloves will not help you.
Yeah, that's exactly my thought, that wasn't helpful to me at all. And so I understand that. And as far as essential workers go, both of you all are essential to me. And as a mother, I'm essential to my kids and my husband, and we're all essential. And I just believe that. But we're talking now, there's conversation around school starting back, and our teachers who are also very essential, and our kids going back into the school environment. I have my own thoughts about that, but I would like to get you guys' opinion about it. So Dr. Ugo, you want to talk about it from New York's perspective and overall?
Yeah, I think that as the coronavirus goes, it is the big unresolved question that we all have to deal with, because there are very real factors on both cases. The obvious one is the risk of, the kids getting infected. We all know anyone who's had taken their kid to a daycare for the first time or to a new school for the first time. The germ spread is astronomical. Families deal with the germs just as much as the kids do. And so even if the kids do fine, and some kids can get sick from coronavirus, but even if they do fine, they will pass the germs on to their families is the theoretical risk. The initial data shows that transmission is relatively on the low side, but still that risk is there. That's all on one side. On the other side, you have the fact that these are kids who, unlike adults, if you woke up tomorrow and it was mid-year 2021, you'd be a little disoriented, but you'd quickly be able to get back to work and be functional. Within a day or two, you'd figure it out.
True.
For kids, every year, every month is filled with educational goals, developmental goals.
Mm-hmm.
There's a big difference between a 12-year-old and a 13-year-old, or a 7-year-old and a 6-year-old. And so on the other side of the viral public health risk is the developmental educational risk of keeping our kids out of schools and out of each other's pathways. And so it's not an easy calculus. I think that at the end of the day, it has to be personalized. I do think that the Department of Education needs to have a plan that's out there in phases for cities and states in different phases. And so if you're having an increase in your numbers, this may not be the time as a city, this may not be the time to open schools as much as you want to. It may behoove you to wait another month or two, 4 to 8 weeks to see if the numbers are going down and we can get the kids back to school. But if you're in a place like Connecticut, New York, New Jersey, some other states where the numbers are on the way down, then it might be more reasonable to let the kids go back to school, but still to have a surveillance team in place where if any of the family members or the kids get sick, right away there's testing as possible, contact tracing, and then whether it's taking some people out of the school or shutting things down, the ability to respond pretty quickly needs to be in place. And so it's going to be dynamic, it's going to be tailored, and we just need to do our best. But there's no one size fits all, but there definitely needs to be more guidance from a federal standpoint.
Yeah. And Dr. Gloria, I know that you are, your university opens up in a little while too, and that there is a virtual option there. So what do you think about that virtual learning aspect? And maybe more so just for the teacher's perspective as a professor, and, just that transition of how do you teach, that way virtually?
Right. Well, for me, fortunately, I've taught virtually before, so it's not new for me. But for many professors, especially those who teach face to face, and that's been how their modality has been for teaching, it's a little harder for them to adjust to doing things online. Our university, though, will have a hybrid of sorts. There will be some face-to-face classes as well as virtual classes, online classes. And I think that's across the board, depending on the school and also the communities, I'm assuming have a lot to do with that, families and politicians and whoever else is bringing the influence there. But yeah, the teaching online, I think I do both. I've done face-to-face for many years as well. And I love face-to-face as my preference because I love the interaction with students. I love to be able to, the nuances that are there that you can just kind of pick up on in the moment, the learning opportunities, the, spontaneous conversations that can come out of a topic discussion. That's really something I think will be missed in an online environment because it's more ritual and it's more, it's less human contact. So in terms of me looking beyond just my setting, and I think about the whole prospect of kids getting back into school settings, I do understand, as Dr. Ugo said, the need for the developmental part of their growth. Socializing and play is very major in young children's developmental process, and for that to be healthy. And I know, like many parents are concerned that their kids are being they've been alienated from their friends and from their sports, many of the, sports are out. All of the things that keep kids on the straight and narrow, if you will, or give them things to do and to build relationships, those are not available to them right now. Mm-hmm. So there is a mental health issue that we must look at in terms of how this is impacting them developmentally and emotionally. Many kids don't understand. They don't have the concrete abilities to determine, like to assess what is really happening. They don't know what corona is. They don't know why they can't go out to play or why they have to wear a mask. Some of those kinds of things that adults kind of know why, the rationale behind, kids don't necessarily know. Mm-hmm. So there's a lot that goes into this. Again, it's many layers, and I believe in terms of deciding whether or not to let your kids go back if their schools are open, and advocating for that. It is a personal level. I think as families need to make that decision based on some of the things we talked about. What kinds of chronic illnesses are in family members there, where people are physically and mentally in the home. Their well-being must be thought about as well. So it's not just letting them go back, but it's like to protect them, to protect those that are high risk, that are possibly in the home. So there's right. A lot to consider. My thing is just that we just continue to do the best that we can, love our loved ones, our kids, as best as we can, be honest with them, talk to them, have conversations with them about what's going on, and pick their brains so that you can hear what's in their hearts, because they don't necessarily know how to convey what they're feeling and thinking. But it's really important that we stay connected with them and really be available to them through this process too.
And I'm a certified child care director, former daycare owner in my home, and my family calls me the baby whisperer. And yes. I say all that to say that I just love children. I have 4 of my own, and my heart just is for them. I understand the developmental needs and all of that. And I understand that not everyone has a home situation that would kind of lend itself well to virtual learning at home or homeschooling in that way. And and like you said, Dr. Ugo and Dr. Gloria, it is, case by case. It's a personal decision, and it is one that we should take very seriously. If there are illnesses in the home that are, that an adult has or a child has, or, that they can spread, then that family has to take that into consideration and being able to do so. There are a lot of other questions that come into my mind just as it relates to that specifically, but it's not relevant for our conversation today. So maybe we'll talk about it later. Mm-hmm. I do want to thank both of you for your question and answer period today. It's been fun being the host on your show, your guest host today, Dr. Gloria. So thank you for inviting me to do this. I hope that you guys have both, been able to just share what was on your heart to share. And if you have anything now that you haven't said that you think is important to tell our audience, please let me know so we can go ahead and do that.
I'll just chime in and say, just to go back to the last topic, and we kind of circled around it, the educators like yourself, they care about the kids, they want to be there, but we have to protect our educators. In a way that, the doctors and nurses really weren't protected earlier on in the pandemic, when we didn't have the personal protective equipment. So if we are, for states that are mandating that schools reopen, and even for those who it's an option, I think this is a federal issue. We need to pass through Congress, through Senate, money appropriated to protect our educators so that schools can reopen safely for the teachers. And we need input from the unions. What does that mean? Do they need face shields? What do they need? Hand sanitizers, what is it? Right. Whether it's UV lights, things to help with ventilation, whatever it is, between the public health standpoint and just concerns from the teachers, the educators themselves and their unions, I think it's worth federal dollars to make sure that our educators are protected.
Yeah. I agree with you. Yeah, I agree.
Yes, I agree.
Dr. Gloria, I want to chime in about your book just one more time, because I know within there you're talking about, advanced care planning, the healthcare decision making, and setting up a power of attorney, a durable power of attorney, and also a living will. So I know I have a friend who's a teacher in the Texas area, and just recently asked me to be an executor of her estate for, in the event that she does get sick and pass on. But just as far as, still having life and just a life-threatening illness and things, there's a power of a durable attorney and the living will, which is also the advanced directive. If you could, in your final statement, just say something about the importance of that aspect as well for the audience.
Yes, for sure. My passion has been with this work for over 14 years. It started with a near-death experience for myself, that I, had an unexpected illness that was misdiagnosed. And I realized then I was healthy, I was doing well, and all of a sudden I wasn't able to do for myself. Someone else had to take care of me. I realized at that point that I didn't have things in order. My house wasn't in order, if you will. You guys, my children, didn't know what my wishes were. I didn't have anybody to assist in that. And I realized how important it is to prepare for these unexpected things. It doesn't mean that you are wishing it on. I know that some cultures, even our culture in many cases, believe that if you start speaking about death, you're inviting death to come. But it's been my experience through my own near-death experience that we don't leave here until God says so. And I just believe that with my whole heart. So I have really advocated for people to, especially the Black community, to have these conversations with their loved ones, to, talk that out, let them know what your wishes are, so that if something does happen unexpectedly, Lord forbid, but if it does, that you have something in place. And that means to have someone who can advocate for you, someone who can be, speak for you on your behalf if you can't speak for yourself. And it also brings peace of mind. It brings peace of mind to the loved ones. I had a family who, it was so many situations, but this one where the daughter was in an accident and she was considered brain dead. She was in her early 30s, I believe. And the family members were in opposition as to what to do. Do they keep her on the machines when she really wasn't there, or do they take it off? And they were divided. She didn't have a plan. She didn't say what her wishes would be. And when the decision was made to remove the breathing machine and all of that from her, and she passed on, there was all right out hell, just to be honest. The families to this day, some of them don't even speak to each other. This was all because they didn't know. Some felt guilty. Some were saying, well, God's going to heal her again, with the spiritual belief dimension there, which, and then there was those that said that you took her life. And so those kinds of wounds they're just horrible, in my opinion, for families, because life is so short. And, with mom, for example, when my mom passed away 2 years ago, she made her wishes known. I'm so glad she had the wisdom to do that, because we weren't all in agreement as to what should her treatment be in the last days. But because she had made her wishes known, we honored that. And by us honoring that, we are all loving each other through that, and we were all able to support each other. So I see it as a critical need in our communities to make sure that we get our house in order. And it starts by having a conversation with those you love and trust most, and getting that written down in a way that people can honor that, the medical profession and your family.
And I think that's very critical. And that's one of the beauties about your guide, is that it's so simple to read, and all of the feedback that we've gotten, about it states that people use it as a starter, as a conversation starter to start talking about, an issue that nobody wants to talk about, death or dying situations, but your guide really helps people to get that conversation started. So thank you for writing that. And Dr. Ugo, we'll be looking for a book from you soon, because you have so much wisdom and just the way that you do it. I'm just going to put that out there, that we need a book from you soon.
Coming soon. I can't wait to read it. I can't wait to read it myself.
Okay. Well, thank you guys again for for being great guests today on the Heart Talks with Dr. Gloria show. I've been your guest host today, Tracee Holloway. And once again, I just want to thank you all so much for being here.
My pleasure. Thank you for having me.
Thank you, Tracee.
Okay. Bye.